And I know we also wanted to talk a little bit about, and I want to make sure I'm pronouncing this the right way, Diastasis Recti.
Yes.
Did I totally butcher that?
No, no.
Okay.
Diastasis recti is
Recti. Okay.
the technical term for the abdominal separation that occurs during pregnancy.
Okay. And so how
We
does this
call it
happen?
DR for short.
I'm sorry, DR?
Yes.
Okay, that's so much easier. There we go. So how does this happen, and how do moms actually know that they do have it? Is it something that's kind of like told right after they have their baby? And then how can they kind of work on it?
Some degree of abdominal separation will always occur during pregnancy. Everyone's core muscles have to expand to give room for the baby to grow. But in about 60% of pregnancies, the abdominal separation becomes wider than 2 to 2.5 finger widths. And in that case, then you are technically diagnosed with having the condition of the diastasis recti. And so in some cases, this abdominal separation heals naturally post birth with no medical intervention, especially if you take the right steps and do the correct exercises. So it's nothing to be overly concerned about. A big question that I get asked is how to know if a mom has the abdominal separation, the DR. And so there's actually a test that you can do on your own at home. You lie on your back with your knees bent and your feet flat on the floor. From that position, you're going to exhale and lift your head and your shoulders off the floor. And you can gently put one hand behind your neck just to support your head and neck. And then from here, you want to contract your rectus abdominis muscles, focusing on bringing your rib cage to your hips rather than just bringing up your head. And then from here, you can actually place your fingers in a horizontal position across your belly button, and you can feel above, over, and below your belly button. And this will allow you to assess the width and the depth of the abdominal separation, the gap that's referred to as the diastasis recti. So this is relevant information to know not just how wide the gap is, but also to know how firm or how loose the connective tissue between that abdominal separation feels. And then any mom with a width of more than 2 centimeters, and like I said, that's usually about 2 to 2.5 fingers wide, would be considered to have DR.
Okay. And so is that something then they have for the rest of their life, or is that something that they can kind of work on to improve?
Yes.
And what are other symptoms kind of that can come from that?
Sure. So, other symptoms of diastasis recti, the abdominal separation that occurs during pregnancy, the main symptom is a pooch or a bulge in your stomach. Most moms see this especially when they strain or contract their abdominal muscles. Additional symptoms include lower back pain, poor posture, and struggles with constipation and bloating. The good news is that it's never too late to restore your core. So, this is a condition that no matter how many years it's been postpartum, can always be improved. Just like any other muscle, your core muscles respond to proper training and nutrition.
Awesome. Well, that's great. And you said 60% of postpartum moms will have this?
That's correct. Yep.
Wow. Okay. Awesome.
And
So, yeah.
most moms don't realize that they have the condition. So, of that 60%, it's not uncommon for, the majority of those moms not to realize they even have that abdominal separation, especially in those initial postpartum periods. We just chalk it up to mom life with the mom tummy and the bulge. But yes, there is something that can be done for the condition. So,
Yeah, that's great that there's different things that you can do to kind of improve it over time as well. So for anyone kind of listening that is, loving these tips, they want to kind of get back into fitness as postpartum. What tips would you give them? I know we kind of covered this before, but anyone kind of like dealing with their own kind of self-doubt, what would you kind of tell them to encourage them in this new journey?
yeah, I think more is not better, better is better. So don't allow yourself to become too overwhelmed with trying to do, hour-long workouts at the gym, crazy core training, boot camp style workouts. That it's too much. A new mom, you already have so much on your plate. And so focusing on small daily habits, maybe it's just taking a walk around the block, maybe it's 5 minutes of core training. Those are going to add up and get you to a result of a healthy lifestyle, postpartum fitness, weight loss, and all of that will come. But focusing on those small habits is going to be key. Also, if at any point through your workout you notice signs of core weakness, it's really important to find a modification until the entire workout can be completed without any of the following signs that are actually doing more harm than good. And so that would be core training that causes you to strain from your abdomen or your pelvic floor during the exercise. You'll want to avoid those exercises. If any exercise causes you to leak urine when you're doing exercises, or if you notice pelvic or low back pain during the exercise, you want to stop those exercises and focus on that core rehab until you can complete the exercise with a core that is ready for that next stage. So if there's bulging or coning in your abdomen during exercise, that's a sign of intra-abdominal pressure, and that actually makes your abdominal separation worse. So you don't want to be doing exercises that are going to do more harm than good. You do want to begin and ease your way back into a workout routine and be mindful of the ways that your body has changed during pregnancy.
Absolutely. I think it's great that you talk about, kind of easing into it, and there's all different levels, like even just taking a walk around the block. And I think that's great for mental health as well, just getting outside, because especially with this last crazy year, I know a lot of moms were stuck inside, stuck at home. And so just even getting outside for a walk around the block is great.
For sure. Get that vitamin D too if it's sunny where you're at.
Exactly. That's huge, huge. And so, okay, this was awesome. This is great because, like I said, we always get questions about, working out and fitness around having a baby.